Good evening and welcome you all in Foxy Presidential Initiative podcast series Gyan Pravah. Today is episode number 342. Happy New Year to you all. Wishing you joy, peace and prosperity in year 2026 with new hopes, fresh starts and exciting opportunities for growth, success and making wonderful memories like our President Sunita Tandulwadkar Madam bestowed upon us in year 2025. My journey is cherished forever. As I sign off with my final episode for this year, I carry the pride of being part of a legacy Gyan Pravah series shaped by inspiring vision of our dear President Dr. Sunita Tandulwadkar Madam. ज्ञान का बहता रोजाना एक नया अनोखा रंग हर रात हम मिलते हैं और जुड़ते हैं फॉक्सी के संग. Today our guest speaker at 342 episode is Dr. Advocate Hitesh Bhatt and our title of today's episode is Prescription for Justice. Madam Sunita Tandulwadkar, you have given us this opportunity. You are a visionary who has redefined reproductive medicine with excellence, resilience and innovation. You are pioneer in reproductive medicine, renowned for your groundbreaking achievement of delivering India's first stem cell baby and world's first at the age of 45 in 2018. Madam, you served as the head of the department and chief of IVF.
Jyoti,
Yes, ma'am.
not my introduction, it's you and Hitesh.
Madam, this is
मैं
actually
रोज 8 बजे आती हूँ.
जी madam, this is actually 342 episode is the actually a huge milestone for us
I
all.
know. That
And
is true. That is true, dear, but you don't have to describe me.
yes, madam, I
I
seek your
join every
blessing.
day. Welcome, Hitesh. Welcome on a Foxy platform. And I join every day at 8 p.m. just to show the respect to the faculty that they are giving their valuable time to our Foxy for this project, which was, impossible for everyone. They have said me, Sunita, ये पागलपन मत कर, ये नहीं हो पाएगा. 30 chairperson in 30 directions. How can you control and how you will do it every day at 8 p.m.? I said, no, my chairpersons are very sincere. It is the golden opportunity for them and they will definitely do it. This is the only project which was dependent solely on chairperson and they outperform it, outperform. They never changed their dates. Ki I'm busy, you take my date. Never, never. They did amazing job and I'm thankful to them. And I feel giving them an opportunity, showing them the respect and, trusting their capacities. That is most important part. And every president does the same. And that's why our chairperson keeps on shining and they aim to go to VPs and presidency and so on. Hitesh, today you are with us. And thank you, Jyoti, for having Hitesh for your final episode. I'm so glad because Hitesh has helped thousands of our Foxian very close with the Foxy. I myself is very close to Hitesh and I know midnight, 2 o'clock also I'll give a call. Whether I am tied with him or not, Hitesh will always be there to help. And that's the quality of Hitesh. That's why I'm very, very close to him. And I'm so glad today your episode will be outburst. And Hitesh, thank you so much once again and see you at AICOG. I know you always rocked with our all. I don't want your practice to grow, Hitesh. I wish everyone else to grow with their practice in New Year, not with you, Hitesh.
I don't have to do anything. Anyways, the cases are increasing.
Madam, actually, madam, you have given us so much free hand that you never asked me that your committee
Yeah.
is ethics and medical legal committee, so you have to just ask for the medical legal consultant. I invited all the dignitaries from all the streams, but today as my last episode in this Gyan
I'm
Pravah series.
happy and I'm sure I'm enjoying from my viewers link. Hitesh, our protocol is only you and Jyoti will be in the complete screen and I'll be joining the viewers link. And even if I wish to interfere, I won't be able to do. And that's why I dislong. Otherwise, मेरे बेचारे बच्चे तो ऐसे ही रहेंगे और मैं ही बातें करती रहूंगी.
मैडम आपके बेचारे बच्चों को आपने एक साल में बहुत पावरफुल बनाया. I am remembering today the first episode when I was literally at the
So
crying
nervous.
stage. So
Yeah.
nervous and literally in the tears. And today I'm so confident just because you have given this opportunity, madam.
Thank you,
I'm
dear.
also
Thank you so
obliged,
much.
madam, for trusting me. Thank you very much, madam.
Thank you, Hitesh. And enjoy Jyoti and Hitesh. Bye. See you.
Thank you, madam, for your blessings. Now, today, our guest speaker with the title Justice, Miss Sir. Actually, when madam said, when I am here to just say, signing off from this series with my very beloved medical legal consultant, everybody from the gynec fraternity is knowing you. But this episode is actually, we are live on the YouTube or Facebook or everywhere. So for my non-medico friends and non-medico viewers, I just wanted to give you a brief introduction. Dr. Hitesh Bhatt is practicing medico legal subject. He is not only, but renowned doctor come advocate. He is advocate Dr. Hitesh Bhatt and he is practicing in Andheri, Mumbai. He is medical legal consultant of Vadia Maternity Hospital and medical legal consultant of Central Railway Hospital, Mumbai. He is partner of legal firm B&S Medical Legal Consultancies. He is past chairperson of the committee which now I am heading, Ethics and Medical Legal Committee of Foxy. He has authored so many books, but the main which we are using for reference, the Consent in Obs and Gynae, Law Doctor Must Know, MTP Act Made Easy. He is a promoter for Be Safe Indemnity Insurance. And actually, he is the national faculty and everybody is saying, sir, please आ जाइए, sir, please आ जाइए, sir, मेरे बहुत सारे केस हैं, आ नहीं सकता हूँ. Sir, please webinar में आ जाइए, अभी तो मैं फलाने सिटी में हूँ. So we all know that this branch is actually overgrowing and knowingly, unknowingly, we are doing mistakes. Sometimes we are not actually, we are doing everything fine. Still, we actually indulge in the medical legal liabilities, and that time you are severe for our Foxy members, being the obstetrician previously. We are so happy that your better half, she is also a position holder, vice president elect for the Foxy. So we हमारा तो बहुत हक है सर आपको हक से बुलाने का, हक से पूछने का, and we are so happy to say कि every time you save our lives in the medical legal things whenever we are in the trouble. So today I invite you for the Foxy podcast, sir. I am not asking you that much things because this podcast is for the general public also. So basic questions I am asking, and basically this is actually not many people are they have done the MBBS also or gynec degree also with the law. So I just wanted you to give a brief introduction what inclined you for doing this.
Uh, Actually, madam, from my childhood, I was very much interested in logic. And law is nothing but a logic. Law is the only subject where you have to do exactly which is not there in the book, or exactly opposite than what is mentioned in the books. I will give you example. Suppose some client comes to me with charges of murder. I cannot just say that the book says you have to hang yourself, just go and hang yourself. I can't do that. I have to defend. I have to put his points before the court. In our medical books, if patient is having fever with rigors, coming fever again and again, the report is showing malaria, you have to give treatment for malaria, what is mentioned in the book. But I have to find out logic from the books in law. So law is always having some logic. It doesn't give you direct answer. So that has attracted me towards the law. And after doing my MBBS, I had MD. When I was working in one trust hospital, I had one case filed against me because of some death on table. We are not going into the detail of that case, but the lawyer whom I was explaining my case was not able to understand. At that point in time, I understood that there is a need for somebody who knows both the topics, both the subjects. And that is how I did my law.
Sir, but both the profession, law and medicine, both are very demanding profession. So how you just balance this profession? Because as a gynecologist also you are having the huge roaring practice. Now in the law practice also you are doing so good. But these both things they demand so much dedication and so they're
So
demanding of the time, energy, everything.
So I started doing law by the side while I was doing my medical practice. Then I was giving defenses like to the lawyers. I was preparing defense and giving it to the advocates. For that, you don't require any registration. But then I thought that even in spite of giving the defense to the advocates, they are not able to deliver, or they are not able to give answer to the extempore question by the judge. That is again a very tricky situation because you have to convince the judge. So I thought, why not I become advocate? So I had to give up my medical practice. I have given back my medical council registration, and I have registered with the bar council. There are very few doctors, or name only you can count on fingers, only that much who have done this. So I have done that. I have given back my medical council registration after having 20 years of gynec practice, and I have registered with the bar council, and now I am attending the court and I am doing full-fledged advocacy.
Sir, so your clinical background is actually helping you understand the legal system better. Just like you said previously, when you have faced some death on table case, and that time you realized. So when a doctor becomes lawyer, he can understand what is the agony going on in the doctor's mind, or he can understand better. So at what point you realize ki I have to just quit this medical practice, and there must be some point, there must be so many patients, so many cases, but at particular point you just thought about to give this medical
See,
practice and start the bar council practice.
yes, so I gave up my practice little earlier than registering with the bar council, because what I started was, while preparing a defense, what I saw was there were lacunas, and we were not proper. Like if you do not have proper defense, even if you involve me or anybody, nobody can save you. So I thought, why not to have things in place right from beginning? So I started something new that is called preventive medico-legal practice. So I had a help from my partner, Dr. Gitendra Sharma. You all know him. So he's still with the medical council, but he helped me. We designed a structure, and what we did was we have started advising the hospitals, consulting the hospitals for audits. So we started legal audits. So we used to tell them that, okay, keep this, write like this, have this license, everything we started putting in place. So that was quite demanding. Like I had to go to that hospital, I have to audit, I had to go there, I had to audit. So it was taking full day. So that is how my practice grew. And then I thought that I cannot do both. And I had to leave my medical practice way back in around 2013 or 14. I just left, and I started doing preventive medico-legal along with that.
Sir,
Yeah.
in the last 25 years, you have done so many audits, you have seen so many cases. So there must be some common mistakes, means medical legal mistakes, which doctors are doing unknowingly. Knowingly means when we are knowing that this is the 4 gram hemoglobin and the patient came for LSCS, and we did it in without not having any backup or any ICU. That is the knowing mistake. But there are so many mistakes when doctors are doing unknowingly. Can you just tell to our audience what are the common mistakes we doctors did?
See, there is nothing like unknowingly. The point is, they are ignorant of the law. We are not understanding the law. Like whatever we face daily in our life, we even do not implement that thing in our practice. I will give you certain examples. License not there. Suppose you have PCPNDT license that expired and you still continue practicing. Now there is no defense for it. If you get caught doing sonography with expired license, you will definitely be punished for the same. So that is a lack of common sense. You can't say that it is unknowing mistake. It is known, you know that, but you have not given attention to it. That is first part of it. Second thing, we are not learning the law. The law, whenever in many conferences, many lectures, many webinars we are doing, and so many others are doing, they are teaching you the law. They are teaching you the exact law. But we have apathy, or we don't try to learn, or we don't try to retain it, we don't try to listen to it. So that is why the problem happens. The third important thing is we get carried away most of the time. If patient says something, we will do it. Patient says something, we will believe it. Now, if I go to say purchase a SIM card, they don't give me SIM card without my ID. Right? Even if it is SIM card is free, they will tell me that you give your ID, you sign it, then only I will give you. Even in a hotel, they don't give me a room. Even in the smallest of the lodge, They don't give me a room unless I produce my ID. But we take our patients without taking ID. So this is our fault. Whatever we are suffering, whatever we are going through in day-to-day life, we don't have that much common sense to implement it in our practice. So that is the biggest mistake we have.
And we don't have the
Never,
courage to just ask the IDs. We just have thinking we will lose the patient. But if we all starts doing the same thing, then there is no fear of losing patients also.
just I made one video today for the same, like why to take ID. You don't know what intentions the patients have. Like there is one interesting case where one patient called, say, his name was, say, Pratap. Pratap was brought in ICU in emergency ward as a dead. So he was brought dead. Postmortem was done by 10:30 in the morning. Now some other fellow came to that hospital, same hospital, with name Pratap, same address, same age. He took out the case paper and he said, I am having some gastric burning and gastric this thing, that thing. And doctor saw him and wrote prescription also to him. Now what actually happened, this Pratap was killed by giving poison. That was there in the postmortem. Now this defense, they have produced this case paper that Pratap was alive till 2:30 in the afternoon. See this case paper. Now the doctor doing postmortem is also in a problem. Doctor giving that treatment is also in a problem. They have not asked for ID. They have just taken out the case paper. Now you don't know what purpose they have done this. There are cases where one patient has come with somebody and got pregnant with the boyfriend, right? Now original husband has claimed that she has become pregnant, that their divorce case is going on. Now you understand, if she is pregnant during the pendency of the divorce, she will get 20 crore rupees alimony. If she is not pregnant, she will get only 10 crore. So you don't know their intentions, right? You can't trust anyone. So you require certain documents to be collected at your place. You must take those documents. But we fail to do that. And whenever it comes on to us, we have to give. Even my mother, she is alive. The bank manager is staying just next building to us. Still he is asking for her the proof of her life every year. He is calling her and he is asking, "Aapka hayati ka dakhla do." They are asking. So they don't trust us because they go by law. So why can't we go by law? That is the problem.
Yes. Sir, in your experience, which specialty face the highest litigation, like surgery or obs-gynae or medicine or pediatrics?
Obs-gynae is number one because there are issues with two patients. One is the patient herself and second is the child. So both can have problems. So obs-gynae naturally, and there are so many laws which are surrounding the OBGYN practice, like Birth and Death Registration Act, MTP Act, ART Act, PCP&DT Act. There are so many acts which are applicable to obs-gynae practice. So they are number one in litigation. Then comes the plastic surgeons, urosurgeons, laparoscopic surgeons, and basically the other branches like the super specialists.
Sir, in the obs-gynae, when we are taking all the webinars from our committee side or in general also, most of the time we heard from you that we should take the informed consent, we should take informed consent properly. So still it is the weakest link in the medical practice. So actually, what is the reason for this? Why this informed consent still is the weakest link? Still we are having so many judgment which are saying how to take consent, why to take consent, from whom you have to take, in which words we have to take. Still it is the weakest link and we are losing cases in court of law just because of this mistakes in the taking informed consent.
Yeah, so see, the consent is basically a contract. And contract in every field, it has grown to from basics to more exhaustive paperwork. If you see, I always give this example in my talks that if you go to Porbandar, where Gandhiji was born, if you see Gandhiji's house where he was born, it is under now as a national heritage building. That place, if you see, there is one frame there. In frame, it is a contract of purchasing that house. It is just a piece of paper. It is 1/4 of A4 size paper. that I, Mr. So-and-so, I, Mrs. So-and-so, some Parsi lady, sell this property to Karamchand Gandhi for 151 rupees only. Can you purchase even a 2 BHK or 1 BHK with that kind of paper today? We can't. So contract has grown. When I took my first loan from the bank, I signed almost 25 pages. When I took recently one loan from the bank, I have signed almost 100 pages. They also have increased their paper strength. But we doctors, we were writing in the past that I want to undergo dash surgery. I have no other complaint against the doctor. I have understood all the complications, all the side effects, and I will not complain against the doctor and staff. That type of consent we used to take in 2090, 2000, 2010, 2020 and continuing. We have not grown. So that is what is the biggest problem. We have to understand that consent is something, and it is not only always going against us. If the consent is proper, it will help you as well. And there are cases, even with me, there is one case we won just because the consent was proper. And what is proper consent, that also is said by the Supreme Court. So we have to follow that. So we must take proper consent as per the Supreme Court's guideline.
Just you said that now the documentation and the paperwork is actually increased and we have to follow. So many a time doctors are saying that we are so busy and we cannot take the detailed consent. So how can doctors balance this detailed consent with time consent? Means they should just they have a typed consent, or they have a blanket consent, or they have a procedure specific consent in their clinic for this is for hysterectomy, this is for LSCS, this is for MTP. Means how they can balance, because many a times बड़े डॉक्टर है, उन्होंने कह दिया ये हमारा जूनियर डॉक्टर है, ये आपसे कंसल्ट लेगा. एंड जूनियर डॉक्टर इन जस्ट लाइक अ मेडिकल कॉलेज, व्हाट यू सेड कि मुझे बता दिया गया है, मुझे इस सर्जरी से ये नुकसान है, ये फायदे हैं, एक अंगूठा लगा लेते हैं. So how can they balance about this?
See, I will answer both the things. The first thing is, what is a real and valid consent? That is the consent Supreme Court has said to take. That is what India follows. Now, that is something, you should have 6 things in every consent. What are those 6 things? First, you have to say the nature of the procedure. Suppose it is cesarean, you have to tell that I am going to put an incision of the abdomen, I will open the abdominal layers, I will open the uterus, I will take the baby out, I will suture the uterus, I will suture this. Like, you have to tell the procedure in short. Second thing, you have to tell the probable outcome. Like, you will have 100% success, 50% success, 20% success, or good success, poor success, fair success, success rate. Third is, you have to tell the benefit, that what benefit you will get by doing this surgery. Fourth, you will have to tell the risk involved in the procedure. Fifth thing, you have to tell the alternates. If this procedure is not done, what else can be done? You can always write that labor trial can be given, something like whatever, or instrumental delivery can be done. So that is alternate. An ill effect of no treatment. What if the cesarean is not done? There is fetal distress, baby may die. There is placenta previa, you will bleed to death. Like whatever. So whatever ill effect can be there, that you have to mention. So these 6 things should be a part of consent. Now, the nature, benefit, alternate, ill effect, and what if the treatment is not done for cesarean is not same as procedure, benefit, alternate, ill effect of hysterectomy. Is not the procedure, ill effect, alternate, ill effect of cholecystectomy. Is not the same as procedure, ill effect, alternate, and benefit, or the percentage of outcome of the cancer surgery. So each surgery should have procedure specific consent. Now, most of the things can be pre-printed. Like procedure for cesarean will remain same, that you can have pre-printed. Risk, the list of risk will be same, because whatever risk any person will have will be the same, that you can write. So only columns left blank are alternates and ill effect of no treatment. Those you have to put as per the case. So you have to write certain things are pre-printed. It's like when you purchase a flat from builder, he will write that I am Mr. So-and-so, his name will be printed, selling a flat number dash, and the flat number is dash, the area is dash, per square foot rate is dash, rest of the things are printed. So that is what we also should do in the practice. None, when it comes to the time, like I told you, busy practitioner, I gave that answer to one madam. One madam asked me that I don't have time because I have huge practice. I said, madam, if you have huge practice means you have more money. Keep some staff. She said, no, I don't earn that much. I said, then you must be having time. You can't not have both. Either you will have time or you will have money, because time is inversely proportional to money. So either you will have time or you have money. You can't not have both.
Sir, actually, just pre-printed form. You also have fought one case that was from Indore, that there were pre-printed form for the sonography, and they just forgot to cut the thing. Everything is normal. All four limbs are seen, and they just means forgot to cut the things. And when the anomaly baby was born, and the ruckus was going on, and they lost. Actually, radiologist lost the case just because if we are using the pre-printed form, we have to just see if there is some negative comment we have to give in the report or in the consent or anything. We have to just see that thing also in the negative comment box.
So in any case paper or consent or any document, I am not of the opinion you write yes and no both and the person will have to cut.
Yes.
I put a blank. Why? Because when you put blank, the other person will use brain and write it. When it is printed already, they will not use the brain, neither they will cut it. Also in cutting, there are two things. If there is something to be cut, you have to either cut or you have to circle the correct thing. But sometimes they put tick mark, and instead of tick mark, they just do this. When you just put a cross, it actually cuts the right thing which you want to tick. So always go for circling the things. And I always say that do not write important information as pre-printed thing. Whatever is important, you leave it blank so that the other person will use the brain and put it. If it looks printed, if it looks filled, nobody will use their brain to change it or to put a cut or to put a circle against the correct thing. You understand what I'm telling?
Yes.
So most important things like say you want to write edema. Don't print yes or no. Leave it blank. Let the doctor write yes or no. If you print yes and no both, he will never take it. So that is the problem. So don't give too much spoon feeding.
Yes.
So we
these
have
are
designed documents, and that we are giving to our clients. We have designed it in such a way that wherever the brain is required to be used, they are using it.
So there are the small mistakes, and what are the top documentation mistakes which land doctors in court? Like in the consent form, you said, if we are taking this blanket sort of consent, or we are not documenting properly, yes or no. There are so many other things also where the documentation mistake are done with the nursing homes or the doctors. Especially we are talking here about the obstetrician and gynecologist. So just name few documentation mistakes so we can just learn from that.
So first of all, whenever we become consultant, never forget whatever you have learnt in your residency. Write case paper completely, chief complaint, history, examination, provisional diagnosis, investigation, final diagnosis, plan of treatment. When I talk about investigation, gynec is the only branch we have stopped doing PSPV examination. And there is no textbook which says that PSPV is not required. We are not doing it. See, if you see a physician, they also have Holter machine, ECG machine, CT angio, echo. They have all the investigations, but still, whenever I go to my physician friend, he will put stethoscope on the chest. Why he is doing that? Because that is his local examination. If you go to ophthalmologists, they also have computers which can take out the numbers. They also have machines or sonographies which can see retina, but he will put a frame, he will change the glass, and he will ask you, he will do refraction on his own. Why? Because that is his local examination. Only gynecs have become God. They have stopped doing PSPV examination. That is the biggest mistake they are doing. Because no textbook ever I have seen till now which says that PSPV should not be done. And we are having cases where there is cervical erosion or CA cervix is missed in infertile patients. Embryos are made, but CA cervix was missed. It was found only on the day of embryo transfer. So that is the biggest mistake we are doing. So that we have to. Also, we are not writing post-operative findings. We are not writing operative notes properly. When we were residents, We used to write operative notes, patient taken inside the operation theatre, painting, draping done, the doctor with cap, mask, gown, gloves on, the transverse incision was kept 2 centimeter above the pubic symphysis, abdomen was opened. I am not practicing, still I know it by heart. But when I see case paper today, hysterectomy done. That is the operative notes they are writing. Please do not do that. Maintain your good habits. You can have pre-printed notes. Just write few findings. Keep it pre-printed from taking patients inside to patient going outside. Post-op care. We see the patient, we don't write it. So in the eyes of law, you have not seen the patient. That is the mistake. Also, there is no coherence, there is no coordination between doctor's finding and nurse's finding. Now I will give you one example where I will not name the hospital, but the point is patient had PPH and patient had hypotension. Now whenever in cesarean there is PPH and hypotension, the anesthetist will give mefentin. We must have heard about that drug, right? Mefentin. So anesthetist has written 15 milligram mefentin given. In nursing notes, the nurse has given, he has written 15.0 milligram mefentin given. Nurse has written 150 milligram mefentin given. Now the opposite party is telling that since 150 milligram mefentin is given, the patient has died. The patient has died of PPH. Now it is very difficult for me to convince the judge that it is not because of drug, it is because of PPH and the drug was given only 15 milligram. So in all other crimes, if you see, that is my observation, and people appreciate this, I will tell you, in all other crimes, the evidence, the chief evidence is always with the opposite party. Suppose there is a murder, the murder weapon will be with the police, who are a complainant. The wrong check will be with the person who has suffered. Wrong agreement, it will be with the person who has suffered. In medical practice, the chief evidence is our case paper, and that is with us, the defense, right? So you cannot deny it also. In a murder weapon, I can always say as a defense that this is not this is not the knife which was used in the murder, or this is not the weapon which I have ever seen. You can say that. But here you can't say. It is your own document, your own handwriting, your own hospital stamp. How can you say this is not mine? So only way out is to make it perfect. There is no other way. So you have to make your documents perfect. Whether you have time or you have assistants. Whatever you have to make documents.
Actually, there are no such laws that you have to complete your document within minutes. You can take your own time to just complete the document. You can just write any time in the document that I need to complete the document within this time frame. I was just busy in managing the PPH. But many a time doctors are thinking we have to complete the document right now, and they are actually writing. Sometimes they are actually missing the chief things to written on the paper. Sometimes they are writing something, junior doctor is writing something, and nurses are writing something. We all are actually worked in the charitable hospital or the government hospitals in a point of time, and we have seen such a huge crowd. But when we are doing private practice, we are just answerable to our own things. We have to be very careful about writing anything and just preserving the record. Everybody is knowing PCP entity में
Now,
कितने साल रख रहा है.
I would like to add one thing here when you said this. Everybody has to write their own part. Like in the previous example which I gave, 15 milligram mefentin was given by anesthetist. Why the nurse should write that 150 milligram mefentin was given by anesthetist? You say what you have done. Don't write what the third party has done.
Yes.
So that also is a problem. We are writing for some other person. There is one more case where the nurse has written that doctor came for round at 7:30 p.m. Now the patient's complaint was patient was not seen in the afternoon. Doctor had written the finding in the afternoon. Nurse had not written in the afternoon that doctor has taken the round. In the evening she wrote that because another nurse has come. She wrote that doctor has taken the round. Now the patient is telling that why afternoon you have not written. That means this finding is forged. Now how to prove it? Why you are writing what doctor has done? You write what you have done. So that also is a mistake we are doing.
So these
So
all are
staff
the
training
medical.
is also required.
Yes, these all are the medical records, sir, and everybody is knowing about how long we have to keep the medical record. But nowadays, there is the era of the digital records and WhatsApp communication. We all are doing WhatsApp communication with the patient. Many times, though we are knowing it is not that much safer, still we are doing the communication with the patient on the WhatsApp, or sometimes they are calling on the phone, and we are just just thinking that this patient is with me in the antenatal period for 8th month or 7th month, and we are just answering on the WhatsApp. So it is admissible as a evidence, this digital records and WhatsApp communication.
See, it's a tricky question. The thing is, in the Bharatiya Sakhya Adhiniyam, that is the Indian Evidence Act, the new name is this. They have added electronic evidence as a primary evidence if the custody is proper, like if you can justify the custody. There should not be any alteration, and there should be a certificate from the expert that these records are not changed or these records are proper. Now that usually never happens. Many times in electronic record we forget to write. I will give you one example here. In India, the practice is also different. Like patient will come, it is your last case, you have opened your computer, you have entered whatever complaint she had. You have written the treatment, you have switched off your computer, and you are going to go out. That time patient will enter and says, "Sir, I have cough also since 2 days. Can you prescribe anything else?" Doctor will just write it on the prescription. He will not enter it in the case paper, in the computer, because that again he will have to start a system. He has to log into his software. He has to put that complaint. Nobody will do this. Nobody. Right. So that is the problem. So now when you don't enter, that information will be missing. If it is a paper, what you will do? Okay, give me that. You will add it. Right. So if it is paper, you will do it. So we are not tech savvy. That is our biggest problem. So when you are not tech savvy, it is like when you don't know driving, don't drive. So when you are not tech savvy, it is not something which is your cup of tea. You can't have electronic record, and even America and England is struggling to make all the hospitals paperless. We are all, as such, lagging behind by 50 years. So I always tell in my talk that to become paperless, we will have to take next birth. It will not happen in our this birth.
Sir, like this WhatsApp communication, sometimes just like we are actually every gynecologist is actually now doing the defensive practice. All of a sudden, if some patient, known patient, which is not now she is not showing us. She is the old patient which we delivered. Now she is just putting one photograph of one दवाई के पत्ते का फोटोग्राफ डाल के शी इज राइटिंग द कंप्लेंट आस्किंग कि मैडम ये दवाई मैं ले लूं क्या इन सच सिचुएशन व्हाट द गायनेकोलॉजिस्ट शुड डू
You have to say that I cannot opine like that. Please come. I have to examine and then only I can opine.
Okay.
Always do that. Never give any advice for free over the phone or over this kind of communication. There is a place for telemedicine, but telemedicine is altogether a different subject. You have to have proper telemedicine consultation in a way the medical council has said, and then only telemedicine is allowed. Otherwise, giving just prescription on a WhatsApp is actually a casual attitude, and you should not do that. You should refrain from doing that.
Sir, still we average gynecologists are actually not knowing deeply about what are the criminal or what are criminal negligence or what is the civil negligence in our medical legal, means in our practice. Sometimes after indulging in some act, that time only we know कि अच्छा हमारे पर तो criminal case चल रहा है. So what is the difference between the civil and criminal medical negligence just in the for the
So I
sake
will
of
tell you, there are two systems. First is like suppose you are going in a car and your car, somebody bangs his car with your car. Now you have two concerns. The first is your broken car, which requires money for repairing, and second, you are angry on the driver. Why did he do this? So the first system which gets you money, that is called a civil system. You can file a civil case and you can get the money for repairing. Second thing is about anger. For that you can file a police case. Police will put him in the custody or police will hang him, whatever. That is a criminal system. So whenever police gets involved, just be alerted, it's a criminal law. Now, indemnity insurance only covers civil case, not a criminal case. In civil case, it is immaterial who pays. Suppose an order is passed to pay 50 lakh rupees to the sufferer. Either you pay, your wife pay, or indemnity insurance pay. It doesn't matter as long as the patient is getting the compensation. But in criminal law, the punishment is always for the wrongdoer. The one who has done wrong only should be hanged. The one who has actually done crime has to be punished. So in that case, no company can take up that liability. Nobody can go to jail instead of you. So you have to fight this type of cases with tooth and nail, like you have to do everything possible to come out of the criminal case whenever there is a criminal case against you.
Sir, every time when we doctors are getting the notice from the police notice, is it necessary to take the help of the lawyer every time, or a doctor should answer the police notice on FIR?
Any notice you have to take legal help first thing. Also you have to see the person in the practice should be having good knowledge of the legal side or the in law the civil side or a criminal side, or he is into medico legal practice. Why it is so? It is like the best of the ENT surgeon cannot treat vaginitis, though he is treating discharge, but from different organ. He can't treat vaginal discharge. Or the best of the cardiac surgeon cannot suture 4th degree perineal tear, even though he is very big. Similarly, the lawyers who are into some kind of practice, even I myself cannot take a company's dispute or factory dispute cases or land requisition cases. I cannot fight that. I have learnt it as a part of my study, but I am not into that practice. So every lawyer has a different practice. So you have to just see that which kind of practice he is doing, which kind of cases he is dealing with, and then only you have to go ahead with that lawyer.
So there are so many myths in the medical legal practice. Means doctors are most of the time they are afraid. Though we are saying that the Consumer Protection Act is the doctor friendly act, but sometimes we are seeing that is the enemy of the doctors. And recent court judgments, the doctors are actually doing the defensive practice. So have you seen the changing trends in the way doctor are practiced, or the doctor should practice defensively? Is it advisable from your side?
There is nothing like defensive practice. It is actually a alert practice. You have to be alert. Every patient is a potential litigant. You understand that. If you have this understanding, you will definitely make proper documents, proper consents, and proper treatment. And always treat the patient as if you are treating your relative. So you have to treat the patients as per the medical standards. You have to follow whatever is mentioned in the textbook, because whatever you have done should be justified before the law. In the eyes of judge, if I have to convince him, I have to show him some reference. So don't do something out of the blue. Don't do something which is not mentioned anywhere. There has to be some reference for whatever you have done. And you have to document whatever you have done. When I get cases from the doctors, they will give me story for 1 hour that how they tried to save the patient from PPH. I did this, B-Lynch and this and that, and then ultimately I did hysterectomy, this, that. But when I ask for the case paper, it is half a page they are sending me. So don't try to convince your lawyer. They have to convince the judge, and he will go by the papers. So please document everything, write everything properly, and then you be prepared for a proper defense.
Sir, you are saying there is nothing like defensive medicine, it is like a alert medicine. But
Yes.
still we are having very friendly with the term defensive medicine, and every doctor is nowadays saying that it is harming the patient care. हम करना तो बहुत कुछ चाहते हैं, but all of a sudden हमारा mind इतना alert हो जाता है कि we are just started thinking about ourselves कि ये करने से ये हो सकता है. So is this alert medicine or defensive medicine, it is harming the patient care in routine? Do you think?
Yes, it will. Like it is actually, doctors may avoid the cases. They fear, but that fear is actually not a true fear, because whatever you do, even from a simplest of the case, the things can go wrong. And the worst case, they expect only that the worst outcome. And if you give result, you will definitely succeed. Like you will have a good name. So actually, it is a misnomer. Actually, we are doing something wrong. We have to give primary treatment to the extent possible. Don't be don't give any heroic treatment. I don't say that, because in conference you learn something and don't start implementing on your patient. You just learn, you excel, and then you implement. And you document properly. No need to fear if you are on the right side of the law. And also, communication is the key. We are failing at communication at times. I have seen many cases. Even I myself had complications in my life, but the cases were not filed against me in my private practice anytime. Why? Because the communication was proper. If patient is serious, tell them that patient is serious. If something goes wrong, tell them that this has happened. If you try to hide it, then the problem happens. There is a case, I will tell you, that during cesarean, the bladder was, there was some injury to the bladder. Bladder got injured. That happens, right? Doctor sutured that and put catheter and discharged the patient with catheter. They did not write it in their notes. They did not tell the relatives. Now that patient went to her home and another patient from the same doctor came. She said, "Arey, mera catheter to ek din mein nikal liya tha. My catheter was removed in 1 day. Why your catheter is for 7 days?" They went to GP. He said they must have perforated the bladder. Was the urine blood stained in initially? She said yes, it was blood stained for half a day. And the problem started. So do not try to hide anything. I also have created complication, but I have said that, see boss, this has happened. And I envisaged that. I told them also that this is a case of endometriosis. There is a chance of injury. It may happen. And it happened. And patient was ready because I have already told them that there can be a chance of injury. So you tell them whatever is there. You tell the charges properly. You take consent properly and you will not have any problem. And always be there. If there is any complication, always be there. Whenever there was, I gave this example where there was a intestinal perforation while doing hysterectomy in grade 4 endometriosis case. And I was there with the patient till she was cured. I took her to the place, her colostomy was done, she was cured. And then we treated other family members of that family as well. There was no case filed because they were so satisfied. You have to be there. It should be seen that you are there, you are caring for them. That is most important.
So, sir, where should we doctors draw the line between the moral duty and the legal safety?
See, moral duty is always permanent. What is moral duty? Moral duty is socially whatever you do, what your social behavior, professional behavior is something which you do it in front of somebody. Moral is something which you do when nobody is seeing you. That is moral. It should come from within. Like, I want to do this for this. So if you do that, if you show that, there won't be any problem, right? So it is, everybody has their own way of practicing, but we have to be human first. We have to be the professionals afterwards. First we have to be human. Like what you would have done if that would have happened to your relative. Just think that and try to do everything. I don't say you accept something or you say you have to be very firm in whatever you have done. You have to be sure about it. You have to be justified and you have to be you have to take proper consents for the same. All these things should be there. It should not come suddenly that you also don't know and something has come up. That also happens. But that you have to explain to the patient that this has happened suddenly. We were also not knowing that this has happened. Right? So that is how the things will happen.
You told us that we have to just remember our residency days, that what we were doing, how we are doing notes, closing the abdomen in the layers or the uterus. So, what medical legal habit should resident and young consultants develop from the day one? Like documentation and informed consent. What one habit they should develop from the day one?
See, counseling, document the counseling and make proper notes. These are the things they have to learn.
I think, sir, communication also nowadays.
Counseling is communication. Counseling is a part of communication.
Communication and documenting the counseling. This is the things actually.
These are the things they have to learn.
Don't you think this medical legal education should be mandatory in our medical curriculum? Because when we land up in something like medical legal, that हमने कब पढ़ा था ये नहीं पढ़ा था.
Whatever law are related to medical practice like MTP, PCP, NDT, ART, they are part of curriculum already. They are teaching it. And other laws you have to know. Like nobody has told me till this age that murder is a crime. Nobody came and told me. I must know it. So ignorance of the law will never be a defense. And we are fortunate that Fogsi is arranging medical legal seminar. They have even created one committee way back, many years back. So we are already alert. Only thing is we have to listen to it, we have to attend to it, and we have to remember certain things. And whatever your common sense says, no, that is a law. You understand that? Law is not beyond your common sense. It is within the limits of common sense. Whatever your common sense says, Whatever you see in day-to-day practice, that is a law, and that you have to follow in your practice as well.
I'm taking now just one line questions. If given a choice, consent form or case sheet, which is more important for you?
Both. It is like the consent is I always say consent is your extremities, and case paper is your body. Now, body without extremities and extremities without body are useless. It has to be combined together.
Yeah. Which document doctor most often forget?
Which document doctor most often forget?
Yeah.
Consent.
Sometimes they just forget to take consent and they are just touching. Just we are saying
Or
so
they
many.
take, there is misnomer in consent also, they take husband's consent. Now, there is nothing like husband's consent. Each patient gives consent who is of adult age for herself. Nobody else can give consent. Rest all are witness.
Sir, one sentence every doctor should remember in court.
Always have in the court,
Yeah.
always tell the truth, whatever has happened. It is easy to justify the truth rather than justifying the lies which you are putting before the judge.
Sir, your biggest courtroom learning as a doctor lawyer.
It is, there is a lack of knowledge of medicine among judges and the opposite party, and I have to start with pathophysiology of the diseases there, and I actually tell them, and then I make them understand that why this has happened or why that has happened.
So you are doctor from a very busy fraternity like obstetric and gynecology, and it is actually it is the fraternity or it is the branch जहाँ आधी रात को भी उठ उठ के आपको भागना रहता था, and actually challenging branch है. So what particular thing is keeping you motivated to just doing the challenging role, dual role? So you are saying that you surrendered this medical council number, still in your heart you are a doctor. So you have to play the dual role. Be just you are not actually now you are not holding knife, but still you are a doctor. If I am calling you or asking Hitesh sir, मुझे please बता दीजिए यहाँ, still you will do that thing for your colleague. So what keeps you motivating for doing such things? Many a times we are taking free of charge. Many a times we are knowing that we are out. We are calling you, sir. This problem is happening, and you are not saying now that I am lawyer and just come to my clinic or means my consultation chamber. Many a time we are doing free of charge services for our own fraternity. So there must be something you have motivated from the day one कि ये ऐसा है जिसके लिए मुझे मेरे fraternity के लिए काम करना है.
I have seen that out of all the professions, I have tried many professions also. I have been associated with many professions, may it be politics, may it be acting, may it be engineers, whatsoever, and now even the legal. The most genuine profession is a medical profession till date. That is what I firmly believe within my heart. And that is why I am not taking a single case against the doctor. I am getting 20 offers in a month to take up cases against the doctor. If I start doing that, I will earn much more than what I am earning today. But I have decided to defend doctors. And whenever doctors come to me, my first role starts with their frustration. Many doctors have stopped practicing. Many doctors are so frustrated that they fear so much they don't operate now that kind of cases. So I first start with counseling to them. I just give counseling to them. And that gives me a lot of satisfaction when they say that, sir, after talking to you, I am feeling good. That is the most satisfying word. Like how you, as a medical practice, how we feel that when patient says that, sir, after talking to you, we feel that our disease we are going through, like we will come out of our disease. Similar satisfaction I am getting as a medical legal consultant when consultant or any doctor says that after talking to you, I am feeling relieved. And that I am get to hear almost every other day. And that is quite satisfying for me, and that keeps me going again and again for my colleagues.
So just like you said, if doctors stop actually doing surgeries, sometimes we just see that the gynecologists are just people are saying just because of this alert practice or this defensive practice, the trend of rising in the cesarean section. सबको डर लगता है कि कहीं सीपी बच्चा ना हो जाए, ज्यादा पेन्स नहीं ले कुछ. एवरीबडी इज सो फेयरफुल. बार बार आप देखते हैं सीटीजी मशीन देख रहे हैं, सब देख रहे हैं, आपका एक बार भी डिप होता है फीटल हार्ट, यू आर जस्ट आफ्टर द पेशेंट कि जस्ट चलो भाई आप सिजेरियन सेक्शन. इज देयर एनीथिंग लाइक यू जस्ट फेल्ट इन द प्रैक्टिस?
I always say that if you see in medico legal, there are the four main pillars of the ethics. In one pillar is non-malfeasance. That means do no harm. It was told for the patient that doctor should not do harm to the patient, but I am saying that it was told for us, do no harm to yourself.
Yes.
See your safety first. That is always there. If you feel that you are not safe, if you feel that you are not confident, if you feel that this patient is not very understanding, they are asking too many questions, they want 100% result. If that is the case, please refer such patient to your nearby colleague.
Sir, before signing off from this episode, you have to give three tips to our all young resident, adult resident, everyone like us, which will be the three legally survival tips for our doctors.
First thing is be master of communication. Always communicate, communicate and communicate. That will definitely save you from problems. Second thing, always document whatever you have learnt during your medical practice. And third thing, whenever in a problem, always engage the lawyers in medical legal practice. Those who are having some medical background or some experience of handling the medical cases or cases of actually medical legal is also a misnomer. So legal cases which are of the doctors, those who are handling, give such cases to them. And fourth thing I would like to add, always have indemnity insurance.
So just I am seeing be safe indemnity.
Yes.
So just give few words about this indemnity, because sometimes we are taking very less indemnity cover for ourselves and the patient is suing us for the more.
Yeah.
So there should be some amount about the practice. ऐसा नहीं है कि प्रैक्टिस बहुत ह्यूज है, पर कई बार हमारे से तो कुछ हुआ नहीं है पिछले 20 सालों में कोई भी गलती, हमारा तो इतने में काम चल जाएगा. Some
You
advice.
must have minimum indemnity of 1 crore because now district commissions are also given power to pass order of any amount. So always have enough indemnity, at least minimum 1 crore. It will cost you around 10,000, 9,000, 10,000 rupees in a year. If you are not earning that much in a year, then it's a different issue. Otherwise, you have to take indemnity insurance of 1 crore minimum. And this insurance is, we are promoting this insurance, we are promoter, it is through ICICI Lombard only, but we have added certain add-ons. Like in no other indemnity insurance, there is 24/7 call center service. You can call us before something goes wrong. Can I do this? Should I do this? Should I do that? That type of service we have added. MTP, PCP, NDT, ART, X we have added. If something goes wrong, we will advise you on those things. So all these things we have added and we have made this Be Safe indemnity. That is for any doctor colleague. It is an insurance for the doctors, by the doctors, of the doctors.
If there is a big immunity or a strong immunity cover for ourselves, then also there is no role of the defensive medicine or defensive practice. Though we have to be alert, but when we know कि we are actually backing by such indemnity cover, थोड़ा सा relaxation हो जाता है कि yes, if
Yes, we
there
are
is
just one call away. And since I have given up my practice of OBGYN, the only way of earning for me is a legal practice. So to be beneficial to both as the doctors as well as for us, we have devised this, that you pay us some amount and we will guide you for entire year what to do, what not to do. And in the case of emergency, suppose patient has died, patient has complication, you know what to do medically, but you don't know what to do legally, right? So that type of, today only I got one phone call from doctor. They said that the child is born to this lady. They want to write the name of their brother and sister as a parents. Can I do that? So I said, please don't do that. They said, as such, they are going to give this child to them. I said, let them do it, but you don't do it. So I am preventing from something from doing. If they would have done it, it is child trafficking. That attracts 10 years of imprisonment. So I am preventing doctors from doing something. That is what is our role, prevention. After doing something, it is impossible to change.
So, sir, thank you very much for coming on this prestigious platform. And as this year is ending, the tenure of this Fogsi presidency is ending, and this Gyan Pravah series is also ending, from my side. Actually, I want you to ask so many questions, but there is the time constraint of only 1 hour. So just for our viewers, doctor viewers, audience, are you available on the phone calls or are you available on the means your consultation
That is
chamber in
my job.
Andheri?
That is what I do. But and the last word of wisdom is you have kept law as last in your series, but keep it first in your practice. Law is something which we have to follow first.
Yes.
Then you do everything. That's
Yes.
it.
And that is the reason, because when I took this committee, ethics and medical legal committee, everybody was thinking कि जब कुछ गड़बड़ हो जाएगी तभी मेडिको लीगल प्रैक्टिशनर के पास जाना है, बट द की इज द बी सेफ. बस जस्ट पहले से ही आप कंसेंट लेके डॉक्यूमेंटेशन करके कम्युनिकेशन करके अगर सेफ्टी से काम करेंगे तो शायद मेडिको लीगल कंसल्टेंट की जरूरत ही नहीं पड़ेगी. वी आर ट्राइंग आवर बेस्ट थ्रू योर कमिटी. यू ऑल डिड सो गुड, sir. And this ethics and medical legal committee, I am just walking on your footsteps, sir. Thank you very much from our Foxy platform.